I'm Marianne Roser. I'm a member of the NBIA Disorders Association Board, and I have the extreme pleasure of introducing our next speaker, Dr. Jenny Wilson. The original name of this session was going to be Getting High with Jenny, but there's always a but. We didn't want you to get the wrong idea or get anybody arrested, so we have changed the name to something much milder, Cannabis Use in NBIA Disorders. Dr. Wilson's an assistant professor of Pediatric Neurology at Doernbecher Children's Hospital, which is affiliated with OHSU, which you all know is the Oregon Health and Science University. And there, Jenny also oversees the neurodevelopment program. She's also an expert in tone and movement disorders and does research in that area. So today she's going to give us the lay of the land in cannabis use or marijuana use in NBIA patients. And she's also going to report on the results of a survey of marijuana use in NBIA patients. So this ought to ward off the afternoon slump. Please join me in welcoming Dr. Wilson.
All right. Hello. Okay, so I'm going to talk a little bit about cannabis use and NBIA disorders. See if I can figure this out. So just to give you an overview of what I'm going to talk about today, I'll talk about just some background so we're all on the same page. I'm going to talk a little bit about the use of cannabis in a variety of neurologic conditions and then report on the survey that we sent out to PCAN patients. So just so we have the terminology straight, cannabis is the term used for the plant genus that contains 3 primary species. Hemp is a less official term and is generally used for derivatives of cannabis that have low THC levels, less than 0.3%, although people have defined that different ways. And then marijuana is also an unofficial term which people use to describe cannabis-derived products that have a higher THC content. And I'm primarily going to be using the term cannabis, which is kind of the official term. And then cannabinoids are what is contained within the cannabis plant. And these are the chemicals that exert their effects on people. And there are at least 66 different cannabinoids. And they exert their effects by binding to different receptors in the body and in the brain. The 2 main cannabinoids that we'll be talking about are THC and CBD, which is cannabidiol. So THC is the part that gets you high. That's the psychoactive component. And this THC has generally been promoted for the treatment of spasticity, specifically in adults with multiple sclerosis, and has also been promoted for the use in chemotherapy-induced vomiting and in pain. Cannabidiol, or CBD, has been promoted primarily for the use in epilepsy. And I'll go into more detail about that. So there are different ways to take cannabis, and I put a subset of the ways here. I realized Googling online there are many, many more ways, but generally people take it by inhalation, that's smoking or like e-cigarettes, sublingual, where it dissolves in the mouth, oral intake, or by G-tube, that's usually in the form of oil or the plant mixed with some sort of food. There are also oral sprays that are used, transdermal gels, and then other topicals like creams and lotions, which are not absorbed very well. I think it's important to talk about adverse effects, and what we know most about adverse effects of cannabis comes from people who smoke a lot of cannabis. And maybe this doesn't come as a big surprise, but it's not a great idea to smoke a lot of cannabis, and particularly if your brain is developing. So in adults who are heavy users, their brain actually shrinks down about 10%, And in adolescents who are heavy users, they tend to have problems with attention, learning, and memory. And a lot of those problems do improve when they stop smoking, but they don't always improve. And there is some data showing that smoking cannabis can predispose to depression or even schizophrenia. And I know that's not really what we're talking about here, but I still think it's important to put that out there. Oral ingestion of cannabis products, that means products that have both THC and CBD, may not cause the same level of side effects that smoking does, though we don't really know. And the data we have is from adults who have taken in oils or sprays, and we do see that those adults can develop nausea, behavior or mood changes, psychiatric symptoms, dizziness, and fatigue. On the other hand, CBD seems to be very well tolerated. Again, this is the part of the plant that's not psychoactive, and we have fairly good data from children who have epilepsy showing that the side effects are really pretty minimal. So kids were a little bit more tired when they had the CBD as compared to placebo. There was an increased risk of diarrhea, probably because of the oil, basically what the CBD was mixed with. For some kids, they had decreased appetite, and there's some risk of having abnormal liver function tests on blood work, particularly if kids were also taking a medication called valproic acid. But overall, the side effects are pretty mild, I would say. I'm not going to go into all the details here, and this is going to be very region specific, but it's kind of a mess, the legalities involved with cannabis. And I just wanted to mention a few things. So, a lot of the difficulty with studying cannabis started in 1970 with the Controlled Substances Act. And this is where Congress basically passed an act that scheduled potentially addictive substances according to basically how addictive they were and how likely they were to be helpful for medical conditions. And marijuana was placed in Schedule 1, which is the most addictive category, which basically those products are not felt to have any medical use. So scheduled the same as cocaine, heroin, LSD. So that's kind of why it's been so difficult to study these products. Over time, there's been development of FDA-approved cannabis products. So in 1985, Marinol was FDA approved, and this is a synthetic THC. And this has specific indications in adults for nausea and vomiting associated with chemotherapy and weight loss in AIDS patients. So it's a pretty narrow use. And this was, if you're interested, listed as a Schedule 3, so you can prescribe it. Then in 1996, the state started legalizing medical marijuana, and now I think it's legal in about 33 states. That number is always changing. But important to note that even in states that legalize medical marijuana, it's still illegal under federal law, which is confusing. And then in 2018, there was a big milestone in that Epidiolex, which is a plant-derived CBD, was FDA approved for epilepsy in children. So this has changed the landscape quite a bit with pediatric epilepsy. And they schedule this as 5, which is the least restrictive. So it's a bit complicated, and this is kind of an ever-changing situation. So going back to cannabis and what we know about it, we don't know a whole lot in terms of what it helps with. There's some randomized controlled data in these conditions here, and I'm not going to talk about all of them. I'm going to talk about mostly conditions that pertain to individuals with NBIA disorders. So the first one is epilepsy, and basically patient 0 was Charlotte. Well, not exactly, but she made the headlines. So Charlotte was a little girl with Dravet syndrome, which is an epileptic encephalopathy, which just means she has really hard to treat seizures and developmental disability because of that. And she was having, I think, hundreds of seizures a day. Nothing seemed to be working. They had heard about another child who had tried CBD oil for seizures and had found benefit, and they managed to persuade their doctors to help them or to allow them to use it. And so she tried it. It seemed to help her seizures quite a bit. And they worked together with some growers to develop a strain called Charlotte's Web. So now, unfortunately, if you Google Charlotte's Web, the book does not come up as the first 3 websites. You find out about this strain of CBD, and you can in fact buy it if you like. So this really kind of galvanized Colorado and the US around making CBD available for children with epilepsy. And with time, a number of companies have developed products, both synthetic and plant-derived, and tested them on children with epilepsy. And the first approved product is Epidiolex, and this, as I said before, is derived from the plant. It's fairly pure CBD, and this was shown in randomized controlled trials of children with 2 types of epilepsy to be effective. It's about as effective as other seizure medications. So it's not this amazing, miraculous, better than any drug we've ever had. It's comparable to other seizure medications. But the good thing is that the side effects seem to be fairly mild. So a little bit of tiredness, particularly if you take it in combination with other medications. You have to monitor for liver enzymes, but overall, kids tend to tolerate it well. Now, the challenge as it stands is that while a doctor can prescribe this for any child with epilepsy, the insurance company is only likely to pay for it if that child has 2 specific types of epilepsy, either Dravet syndrome or Lennox-Gastaut syndrome. So a lot of, I would say probably most kids with NBIA do not fall in those categories. Now this may change with time, they may gain more approval, but currently it's hard to get insurance to pay for it outside of those 2 specific conditions. So moving on a little bit to tone and movement. So there is some interest in the use of cannabis for spasticity and dystonia. In adults, most of the data comes from adults with multiple sclerosis who have muscle spasms or spasticity. And products, most of them are spray products that contain usually a 1-to-1 ratio of CBD and THC, have been studied mostly out of Europe, showing some benefit, mostly with perceived spasticity, like how bad do you feel your muscle spasms are. Oftentimes when the physicians go to actually measure the spasticity, it doesn't feel that different, but the patients are experiencing it as less, and they have less pain as a result of it. So these specific products are not available in the US, but in other countries they are available and used in multiple sclerosis. There have been a couple of studies in adults for dystonia specifically, and those have been negative. They basically showed no benefit, but they weren't very good studies. So really there's only 2 studies in kids that are worth mentioning, so pretty limited. The first study isn't really a research study, it's just a description of 16 patients. So these patients all had very severe spasticity, dystonia, or both, and they were given dronabinol. So this is a synthetic form of THC, which is, as I mentioned before, FDA approved for nausea and vomiting. And basically 12 of these patients had benefit. Now the challenge is there's no control group, so we don't know if their benefit is a placebo effect or if truly this was helpful for their symptoms. But nonetheless, it seemed to help, and they seemed to tolerate it pretty well. So at least somebody published something. And then this got cut off a little bit, but there's a lot of excitement around this study because this was actually a randomized study, but not controlled. This one came out of Israel. And basically, they took 20 patients with dystonia or spasticity or both, and they assigned them to 2 groups. One was on a 6-to-1 ratio of CBD to THC, and the other was on a 20-to-1 ratio of CBD to THC. So still a product with mostly CBD in it. And they followed these groups over, I think, about 5 months or so. And when they looked at all the patients, at the end of those 5 months, they seemed to have decrease in their dystonia and in their spasticity. They also had better quality of life and were sleeping better. Seemed to be fairly well tolerated, so there were worsening seizures in 2, but hard to know if that's due to the cannabis. There were behavioral changes in 2 and sleepiness in 1. And the challenge again with this study is that there was no control group, so we don't know, was this improvement just due to placebo effect? And we know the placebo effect is pretty strong, particularly we know this with cannabis. There was a study of children who were either living in Colorado and taking cannabis for taking CBD for their seizures, and then other children moved from another state to Colorado and took CBD for their seizures. And the children who moved from another state to Colorado were 3 times as likely to report benefit from the CBD. So just the fact of moving and investing more in the treatment made people more likely to report it to be helpful. So this is, again, just highlighting the importance of having a control group, and to say that while, people perceive this to be helpful, we don't know for sure if it was the cannabis itself that helped or placebo effect or some other factor, but seemed to be pretty well tolerated. So that's basically the background and what we know. It's not a lot. We know more about epilepsy than we do about spasticity and dystonia. And the question came up of, is cannabis being used in individuals with NBIA disorders and PCAN? Basically, I have a number of patients who ask me about cannabis, and I give them some vague response depending on the patient. One of those patients has PCAN and asked me about it, and I was like, kind of one of those responses. And they tried it, and it seemed to help him. And things were going along. Then he got admitted to the hospital for GI issues, and dystonia got a lot worse when he was in the hospital. And we were throwing a lot of Valium at him. The Valium did nothing. His dystonia is really bad, and we ask, okay, well, what do you do at home? Well, we give him cannabis, described as something else, but we give him cannabis. And I was like, okay, let's do that. And it made a big difference. All the Valium didn't help, and I could have summed down to the PICU to give him even more Valium, but the cannabis helped. And so to me, it was just a sign that, hey, we need to talk about this a little bit more. We need to investigate what's going on, how many children are using this, and also for me, and I think other physicians, highlight the challenge of what happens when children get admitted to the hospital and hospitals don't allow cannabis to be given. So basically, I worked with the NBIA group at OHSU, and we developed a survey, and the questions we were asking is basically how often is cannabis used among PCAN patients. And I started with PCAN because my patient had PCAN, and I was interested in dystonia and its effect on dystonia. Are there individuals with PCAN finding it to be helpful, and what sort of side effects are they seeing? So this survey went out through PCAN Ready as an additional option that families could fill out. And it went out to the families of children, families who had children with PCAN, so not adults. And the survey went out to 44 individuals, and we got 18 responses back, so thank you for all of you who completed it. The average age of the children with PCAN was 11 years, and it had been 4 years since diagnosis on average. Most of the people who responded were from the US, although there were a handful of other countries represented as well. And just looking at who the children were who were represented by the survey, there's a pretty broad spectrum in terms of level of motor function. So we asked, is your child able to walk, or what's their highest level of motor function? And there was a subset of kids who were unable to roll or sit, and then there was a subset of children who were walking independently, and the spectrum in between. We asked, does your child have spasticity or dystonia? And 15 of those families reported that their child did have spasticity or dystonia. And those children were on an average of 3 different medications to treat their tone, though the range was 0 to 9. And none had used surgical treatments for their tone, such as intrathecal baclofen pump or deep brain stimulation. And this chart just shows the different medications that children were on. The light blue bar tells basically what percentage had ever used that treatment, and the dark blue bar is how many or what percentage were currently using that treatment. So we had a lot of children on baclofen and a fair number on trihexyphenidyl, which is Artane. And then there were quite a few who had tried other medicines or other treatments, including botulinum toxin, benzodiazepines, and opiates to help treat their dystonia or pain. We asked this rather vague question, how helpful are prescribed treatments? I know this is a hard question to answer, but my sense was that families found prescribed treatments for tone to be somewhat helpful, but they weren't usually a slam dunk. Families were not generally saying that, the tone treatments prescribed by their doctors were doing, great, amazing things for their muscle tone. And there were some patients, some families who reported those medicines not really to be helpful. So when we asked about, had you considered using cannabis for your child with PCAN, 11 of 18 families had considered it. And the reasons people consider it are most commonly just a belief that it might help their child, but it was also very common to report that we're interested because it's a natural product, it's plant-based, and then a fair number were interested because their child's symptoms were not otherwise well treated, and for a couple of families it had been specifically recommended to them, and sometimes it's because other children were using it that they knew about. Of the 18 children who we learned about, 7 of them had ever tried it, and 4 of them were currently using it at the time of the survey. Their reasons for using it, what they were trying to treat, was mostly dystonia, some also pain, to help with sleep and to help with anxiety. So I looked a little bit at which children were more likely to be using cannabis compared to the children who weren't. And basically the children who had tried cannabis for their symptoms were the children who were less likely to be able to roll over independently, so did not have as high level of motor function. These aren't the kids who are walking independently. They were more likely to say that they could not sit comfortably. So these are children who, for no period of time, could they sit comfortably. Many of them were uncomfortable, even for a brief period of time. And they tended to be on more medications already to treat their tight muscles, so an average of 5 medications as compared to 1 in the children who had never tried it. And they were more likely to have tried opiates like oxycodone and things like that to treat their pain. So this gets a little bit into the weeds here, but and also, this is a large number of patients, but just to give you an idea of some of the specifics of how people were using cannabis. There were some who had used it for a brief period of time, but there were a couple of children who had been using it for a couple of years or more. And people generally were using oil given by mouth or by G-tube. And most children had only ever used one product, but there were some who had used 2 different products. In terms of the types of products, a lot of families were giving their child a 1-to-1 ratio of CBD to THC, though there were some who were giving products that were just THC or just CBD or a combination of both. And most of the families had gotten these products at a dispensary. The distribution of cost is interesting, so some families were not paying anything for the cannabis, where some were paying over $1,000 a month. So we asked about, how do you think the cannabis has helped your child? So we asked about how much has it helped their dystonia, and most of the families who were using it felt like it was helpful for dystonia, though there was one child where the family felt like it made their dystonia worse, and there was, a couple who had only mild or moderate improvement. Some families felt like it helped their pain, but again, there were some families who felt like it wasn't that helpful for their pain. And again, some felt like it was helpful for sleep, but not everybody. And there were some for whom they saw positive mood effects. In terms of the reported side effects, there was one patient who had sadness, and that caused them to stop the cannabis. And 2 subjects or patients had side effect or potential side effects. They weren't sure. One was agitation and behavior change, and the other was sleepiness and tiredness. So overall, no major issues. We also asked about what was your interaction like with physicians and what happens when you come into the hospital. So there were 5 children who had been admitted to the hospital while they were using cannabis, and 3 of them had been allowed to continue those products while they were in the hospital, and 2 had not. And then 10 of the individuals had discussed the use of marijuana products. This included kids who had not been using it, but we just asked everybody, have you discussed the use of cannabis with your physician? And I was, I guess, encouraged to hear that most of the responses were positive or neutral. There weren't a lot of negative responses from physicians, but there was only one subject who said their physician was helpful. That sounds about right. So in summary, cannabis has potential benefit in neurologic conditions, and the strongest evidence for children is with CBD and epilepsy. And with CBD, the side effects are minimal, and it seems to be helpful for epilepsy. With THC, the data's not quite as good. It may be helpful for spasticity, but the data's really quite limited at this point for dystonia. And as you know, there are potential for psychoactive side effects with THC. And in our survey, we found that cannabis use was relatively common. Now, these are people who decided to respond to a survey that said, tell us about cannabis use. So I'm sure we sampled a very skewed subset of the population, but nonetheless, it is certainly being used. And it's being used for children who are more uncomfortable and who have already tried a number of other medications, which is not very surprising. So, we are considering sending the survey out to other NBIA disorders. I think probably children with BPAN may have heard of this and even tried it. And I think the important thing is that we really need more data to help guide families. We know that people are using cannabis for their children for a number of neurologic conditions, but our data is really lagging behind what's happening right now. So I'm hoping that we can spur on some more research and get some better outcome data to really figure out, is the THC or a combination of THC and CBD helpful for children with dystonia or spasticity, and is it safe? So I think that's yet to come. And at this point, I can't answer the question of should your child try this. So. But you should talk to your doctor about it, and hopefully this at least gives you some background and lays the foundation so that you can have these discussions with your physician. So that's it. I left plenty of time for questions. Yes. Oh, I forgot to put my thanks up there.
Can you talk about the difference between the Epidiolex versus like Charlotte's Web, some of the commercial?
Check. We have a microphone we're going to bring to you.
Yes, so the question is the difference between Epidiolex and basically different forms of CBD that you buy from a dispensary like Charlotte's Web. So Epidiolex is a fairly standardized compound. It is derived from the plant, but it's been tested rigorously. The production is up to FDA standards, so we know exactly what's in it. With Charlotte's Web and other types of CBD oils that you get from a dispensary, there really is less of a guarantee that you're getting what you think you're getting. You may be getting more THC in there too, so there's less consistency, I would say. And I think it's hard to know. I see 2 sides of the coin there. So on the one hand, it's great to have an FDA-approved product. So a child on Epidiolex gets admitted to the hospital, you continue the Epidiolex. The physician can prescribe it and guide you, and so that's really super helpful. I've had occasional families say that they found some product they're getting from dispensary to be more helpful. So, and I don't know what they're getting exactly in there. Maybe there's more THC to it. Maybe it's just something slightly different. But it's certainly less of a controlled and rigorous thing when you get it from a dispensary as opposed to the prescribed form. But yeah, in terms of getting Epidiolex, it's going to be pretty limited at this stage in the game unless you're financially very well-to-do, because although I can prescribe it to anybody, insurance will only pay for it in those very specific epilepsies. So.
We have another question.
Hi. So for those children that don't have any seizures or they don't suffer from epilepsy, has there been any exploration for cannabis use or CBD for just helping them sleep better, to help alleviate some of the sleep disorders?
Yeah, I mean, I think that lots of people try it for sleep, and anecdotally, I've had some families tell me it helps with sleep. The kind of limited research people have done in these studies have shown some benefit for sleep. So I think that's a potential application. There's even less data for use in sleep than for other things, but I've heard that CBD rather than THC is helpful for sleep, and CBD is very well tolerated. So I think the risk-benefit ratio is a little different with CBD. I don't mind if families try it nearly as much because hey, it's very benign, and but I think the jury's out in terms of good research on that at this point.
Can you talk a little bit about pain, how it helps pain?
Talk about pain, is that what you said? And how helpful it is for pain? Is that what you're asking? Yeah. Yeah, I mean, I think there's some data that cannabis can be helpful for pain. And I don't know how much CBD itself is. So when we look at the two ingredients, CBD itself may not be is great for pain, but THC has more potential for use in pain. And it's been best studied in the multiple sclerosis population and in individuals with neuropathic pain, showing some potential benefit. What I've heard from the people who responded to the survey was that there were some improvements in pain. And a lot of the children who are having pain are probably having pain due to dystonia. So it's hard to separate those things out. So I think it's got certainly potential and is used, I think, fairly widely in adult populations for pain as well. Yeah. Oh.
Hi, I was wondering, have any of the families reported improvement in cognitive game or attention span, sense of awareness and alertness while using cannabis?
I've seen that go both ways. So again, this is all anecdotal, so just what people have told me. So I've had families, and there's a family I think who reported just more awareness of little sensations. Anybody's gotten high, you might know what that means. And I mean, other families have reported, okay, my child gets a little tired, maybe a little more zoned out too. So I've seen that go both ways with products that have THC. With CBD, so I have families who tried just CBD, which is not psychoactive, and I've had some families report that their child did seem more aware. But again, this is totally anecdotal. There's no data to support that. I mean, it's interesting, and I think we need better research to understand those sorts of effects, but I have heard that with CBD before. One of you guys, I think you were first. If I remember.
Wait a minute, wait for the mic.
So kind of expanding on her question, I know that THC and CBD can have effects on young minds, especially underdeveloped minds. What would you say the effects are, like developmental-wise? Because we want our children to be able to understand more, speak more, learn more, but CBD could limit that. THC especially could limit that.
Yeah, I think that's the big question that comes up for me. So, if I have a child who's comfortable and engaged with the world, I'm really not going to be, I'm going to dissuade them from using THC. I'd worry about that from what we know about, smoking a lot of THC, what it does to the brain. If I have a child who's suffering and nothing else is helping, and I'm already giving them a ton of Valium. For me, it's, pick your poison, but we want that child, we want a child not to be suffering. And if they're suffering, for me, it kind of tips me over to, not being, not dissuading families from trying it at that point. But yeah, the few families I have who use products that contain THC, they're using it because their child is really suffering from their symptoms. And I think families make good decisions generally for their children, and in those cases, I can understand that. But yeah, I think I get this question about kids who are, walking around, going to school, really engaged, I'm like, oh, I would be really reluctant to throw THC into the mix at that point, so.
Could you please say something about the percentage of the CBD, the active compound in it? Because in the Netherlands, we use it like regularly, at least a lot of people do, and I don't mean the smoking. But do you know, because there it's also warned that if the percentage is too high and you take too much at a time, you get stomach problems and constipation, and I didn't see anything about that in the side effects. Could you please elaborate on that?
So are you asking specifically about like high dosages of THC and the risk of constipation? Or are you asking about, is that what you're asking about, like the high, you said percentages?
Yeah, but the percentage in CBD, so without the addictive compound?
The non-addictive compound, yeah.
Yeah, just only.
Yeah, I think the best data comes from CBD, the Epidiolex that's been studied in research studies. So, I think they used up to like 60 mg per kilo per day of CBD, and they didn't really describe constipation. Actually, it was more diarrhea, I think because of what the CBD gets, the type of oil it gets mixed with. So we didn't see, in that study, they didn't see problems with constipation, but it doesn't mean there aren't people who, there may be people who have constipation with that. I guess my data is limited to those studies, so.
Thank you.
Thank you. Curious about what is being done to educate practitioners and prescribers of CBD and THC products, especially among communities where AEDs are very prevalent. Multiple times it may be several AEDs, and parents who are looking for a solution, who may be weaning off one and trying to come up one, and what might be some insights as to evaluate the efficacy or whether or not a product is working for their child.
So yeah, for education of physicians, and so I'm from Portland, and families have educated themselves already before they come in the room. I would say, particularly with epilepsy in our population. So basically, every family that comes in the room, if their child's not already taking it, they're at least interested or asking about it. So our physicians tend to be pretty aware of CBD use in epilepsy as well. That may not be true everywhere. And now that Epidiolex is actually FDA approved, I think word's gotten out pretty quick about it. Again, the challenge right now is that it's only approved in 2 types of epilepsy. So in children who don't have that type of epilepsy, basically families are still on their own we can't prescribe anything in the cannabis family for them other than Epidiolex. So they're on their own still to go out to a dispensary and buy a product if they want to try it. And, I think everybody's got a different way of practicing, so it's a little hard. I think in general, the world of epilepsy is pretty aware of CBD use. It's big news, I will say, but everybody practices differently. So I think, most of our physicians don't start with it. If a family walks in, their child has new onset epilepsy, it's not going to be our first choice because one, insurance won't cover Epidiolex, and two, from what you get in the dispensary, we don't know what that is. It's not well studied. So we're still starting with our traditional medications as our first line. But I think my sense is that epilepsy doctors and neurologists are pretty aware of Epidiolex at this point, that word's gotten out. But yeah, I think how people practice is going to be pretty varied, and who incorporates it into their practice early and who doesn't is pretty variable.
Thank you. This, you might not be able to answer this, but, and I'm not asking you to endorse any product or anything, but one issue that we families have is which company to go with in terms of quality. And you being an expert in this field, do you have any recommendations as to, not a particular company, but this is something that we use, we see better results with? Because I mean, there's so many out there, and if you just try them all, I mean, that's all we'd be doing,
Yeah, I wish I could guide you better. I'm not going to be able to, unfortunately. I mean, I hear things from families. I have one family that grows their own, and they've developed a company, and I have his card, and there are various organizations that, seem to market towards children and individuals with disabilities and will offer products at lower cost. But in terms of quality and efficacy, there's just no way to, it's so hard to know at this point, and there's so many products out there, I can't even keep track. So yeah, it's kind of the Wild West. There's a very eager hand back there.
Go through the process. I'm sorry. Okay. Yeah, there's only one company that's been approved to produce the Epidiolex, and it's for the CBD oil. It's the only one that the insurance companies will recognize if you have a child or an adult that has been diagnosed with Dravet or Lennox-Gastaut. And I only know that because I have a son with Dravet, and then we have the daughter with the BPAN. So even once it gets prescribed, it's a good 6 to 8 weeks out to get it delivered. There's only 5 pharmacies and they're specialized pharmacies for the Epidiolex.
Mm-hmm. Thank you. Thank you. All right. Great, thank you.